Good morning, everyone. I wish a happy new year to you all. Myself, Dr. Revath. I will be available in this clinic in the evening hours after my working hours at the government hospital. Morning hours will be taken care by my wife, Dr. Swati. So I just want to give a brief presentation of what we do at our clinic. So this is our clinic, which is located just opposite to the Alkapuri Park in Kottapet. We actually believe in perpetual preservation of what is remaining than the meticulous replacement of what is lost. So we give more importance for saving the tooth than replacing it. So we generally practice minimally invasive dentistry. We do only what is required, and we do biomimetic dentistry, which means the final output seems to be more natural, and we believe in digital dentistry, which is the latest trend in dentistry, and we are with all the advanced technologies, and we prefer to give as painless dentistry as possible to our patients. Our main areas of interest are guided implantology, painless dentistry, smile designing, and invisible aligners. So this is what guided implantology is. Generally, if we want to place an implant to a patient, we are supposed to open the gums, drill into the bone, and place an implant there. But in guided implantology, we need not open it. We can just use a guide, place it over the teeth, drill through this hole so that the implant goes to the place where exactly it is planned. We use local anesthetics which are very biocompatible and has got very long-lasting effect, Articaine, and we use topical sprays to make our even injections painless. And for needle-phobic patients, we use needle-free injections. Digital dentistry includes 3D intraoral scans, digital radiographs, 3D printing, and crown fabrication. Everything is, we avoid human interference to avoid errors. Most of the thing is AI generated. So we can even simulate the treatment ahead of the treatment so that the patient will be knowing what exactly is going to happen after the treatment. So these are the 3D intraoral scans which avoid the regular impressions which the dentists they take in their clinics. Here. So this is. Sorry. I want that video to be played.
Which one is the video?
So here, this is a simulation video. Okay. Yeah. So after the intraoral scan, we can analyze how the treatment can happen and how the final output looks like. So this will help for the patient motivation and also to analyze what exactly happened after treatment. Is it as per the plan or not? Next. Here we can clearly show how before and after the video. So here the patient has got some gaps between the teeth, and we have shown them the final output is going to be like this with all the gaps closure, and even the forward placement of the upper front tooth is also corrected in this case. So currently we are running an offer on invisible aligner treatment. So we are providing free consultation and also offering 20% discount on invisible aligner treatment. This offer lasts on up to 31st January. So even for the smile simulation, we can design the smile. So just ahead of the treatment, this patient has got dental fluorosis and yellowish discoloration on the teeth. We have advised veneers to her, and we have shown this kind of improvement in her smile just in ahead of going for the treatment. And this is what we have promised, and this is what we have delivered. And she is absolutely happy with her new smile. This kind of smile improvement is possible with veneers with very minimal amount of trimming of the teeth. Promised and delivered. A similar case of dental fluorosis. The patient has got fluorosis in her lower teeth also, but according to the economical constraints, we have treated only her upper teeth, and did bleaching for the lower teeth, which improved her shade and also the smile is also improved.
The video.
So this is what guided implantology is. Everything is planned in the system ahead of the treatment. So just by drilling through this hole, we will be able to place the implant precisely into the bone, and this will have no sudden surprise. Everything is pre-planned, less chances of complications and less chances of failure, and even the teeth placed and the implants placed will have a better and longer life. So similar case, a front tooth was missing in a patient. We did guided implant placement. If you see here, there is very minimal chance of error. If we go this side, we will be damaging this tooth. If we go this side, we will be damaging this tooth. So we have to place it exactly in the middle. So with free hand, most of the times there is a chance of error. This is what we have planned and this is what we have achieved. And finally, we were able to give the tooth on the day of surgery itself. So this is what is planned. We have planned 4 implants in the lower teeth and 2 implants in the upper teeth. Everything is planned and executed using this guided surgery. So this is an edentulous patient, previous. Edentulous patient has got no teeth in the lower jaw. We are supposed to place 6 implants. We used a guide with 6 holes and we have placed implants with very minimal trauma. The patient can happily eat, chew and everything from the day after the surgery. A similar case where the patient has already got a denture, which is removable one, we have converted it into a physical fixed denture using the implants by placing 4 implants in the lower jaw. So this is a video showing needle-free injection. This patient is actually a needle-phobic patient. He doesn't know, just because of the phobia, he got all his tooth removed without going for the treatment. Finally, we gave him a needle-free solution. Patient is very comfortable as there is no needle for that injection. And finally, we were able to give over-denture for this patient, replacing both his upper and lower teeth. We have a laser in our facility. Using this, we can do bloodless surgeries. This is a patient who was having problems with his speech because of this tongue tie. We have removed that tongue tie using the laser. There is no bleed and patient is happily eating and speaking from the day after surgery. So the cosmetic part is dealt with my wife. She is Dr. Swati, oral and maxillofacial surgeon. In cosmetics, we mainly deal with hair transplants, hair PRP and hair GFC treatments. So feel free to contact. I will be sharing my wife's number and my number at the end of the presentation. And we also deal with orofacial pain. Most of the cases, TMJ pain, this temporomandibular joint pain, headaches, most of the time they have an inbuilt dental relation. So we will be identifying the cause of the pain and we'll try to give the best possible solution. And some other areas where we deal is sports dentistry. We give mouth guards to the ones who are dealing with sports, and sleep apnea. Most of the patients, they breathe with the mouth instead of breathing with the nose. So they will be having snoring. So for them, we do sleep studies and we give anti-snoring devices to them. And mouth breathing and thumb sucking are some of the habits which cause major dental problems. So we give habit breaking appliance to them. And some cosmetic dental jewelry also we deal with, where patients, they insist for jewelry on the teeth. So from BBB and me, along with BBB, I just want to have benefit for both of us. And from BBB, I am looking for already, wherever there is a need, I am looking for my requirement in the beehive, and try and to contact within our chapter and give business to them. So I just want to explore a little more so that I can give more business, and at the same time what I am expecting from you all is every family has got a dental problem. So I don't want you to be patients, but whenever there is a patient, please do remember me. I will try to give the best possible treatment, and at the same time they can feel free to ping me on WhatsApp. I will be answering their queries in my free time. So when someone is not affordable, you can directly send them to my government hospital at Nampally. We do basic treatments like extractions, fillings in our government hospital. If someone is affordable, happily send them to my clinic in Kottapet, Alkapuri. And this is my number, 78422122236 is mine, 35 is my wife number. Depending upon your concern, you can just contact any one of us. I prefer being available on WhatsApp